Welcome back to the Chronicles of a Ghanaian Diaspora Nurse, The Return. Thank you so much for tuning in once again. Today, I am going across the pond to the United States of America, specifically Florida. My guest today is in the person of Dr. Barbara Entsuah. She is a board-certified family medicine physician with masters in community nutrition. She is a fellow of the Ghana College of Physicians and Surgeons and currently works as a physician in primary care in Florida. She is also a philanthropist, an author, and vice president of Gateway of Hope Incorporated, a nonprofit organization that serves Ghanaians through free medical clinics, community health education, and sexual health education in schools. She is very passionate about empowering lay women and men to take charge of their health. Dr. Entsuah is also the author of 4 books: The Dawning of a New Day, a guide to help victims of sexual abuse go through the journey of recovery; A Parental Guide on Teaching Children How to Avoid Sexual Abuse; Young People's Guide to Personal Safety; and the latest book is A Woman's Guide to Her Body and Total Health, released in 2021. Whoa! Dr. Entsuah, welcome to the channel.
Thank you. Thank you for having me.
You know what? The first time I had a chat with you and you mentioned all the work that you are doing in Ghana, I was blown away. And I am beginning to think that possibly diaspora healthcare professionals who are in the diaspora are probably doing a lot more in Ghana and in Africa than we realize. So, first of all, can you just tell us how long you've been a doctor for, Dr. Entsuah?
I've been a doctor for 38 years.
And where were you trained? And how did you come about practicing in the US of A?
Yeah. Well, I was trained at the University of Ghana Medical School. I'm a proud alumni of that place. And after my training, I got married, and then I had to move with my husband, who was then working in Liberia. So I worked in Liberia for about 3 or 4 years in pediatrics. And at that time, I was kind of leaning more towards pediatrics. I had a scholarship to go and do a master's in Canada and in community nutrition, which is the other thing. And so based on that nutrition pad and having worked in pediatrics, at first I thought, well, maybe I could work for a world organization or anything which had to be with kids, you know. And to cut a long story short, I left Canada and then came to the US. And I had the opportunity to either do a residency in family medicine or pediatrics. And after a little bit of pondering and asking around and talking to both pediatricians and family physicians, I finally decided that I'll do family medicine, because then I could even see pediatric patients as well, if you see both adults and pediatrics. So that's how I ended up doing family medicine.
Thank you so much. Wow, 38 years. That's a lot of experience. So can I just ask you, what would you describe as your greatest achievement throughout your medical career?
Well, I think that my greatest achievement, and I think it ties in with what you are doing right now in terms of interviewing people who maybe live in the diaspora and are doing work in Ghana. Mine was the establishment of our NGO, Gateway of Hope. Um, I think we established it in about 2004. And so that's really my greatest achievement, because from that, many things followed, you know. Mhm.
Indeed, and I'm sure we will talk more about the projects when we get there. But I just wanted to know what inspired you to give back to Ghana.
Yeah. I think that maybe I would say two main things. First of all, I was trained in Ghana and I've lived overseas for a number of years. And in going to Ghana, I felt that there was something that me and all of us who are working outside of the country could give back to the nation. And for me, it was medicine because that was my field. But for other people, it could be different. That was one thing. The second thing is that I trained in a Christian family medicine program, and during our training, we were exposed to doing medical missions overseas. And so after the training, I decided, well, why don't I continue doing it? Because I'd learned some of the things you could do. And in terms of organizing medical missions and so on. So I continued in that vein. And my husband too was quite supportive because he also has a heart for helping people. So we combined those passions and ended up forming the organization so we could do work in Ghana.
So inspiring. That is
Mhm.
so inspiring. Like I said before, that when I spoke to you the first time and you were telling me about all these things that you were doing. So, which leads us to the next question. So, tell us about the projects that you are doing in
Okay.
Ghana at the moment. I know
O-
there are many of them, and we want to hear about all of them.
Okay, okay. Well, like I said, one thing leads to another. So we first started with the free medical clinics, which I mentioned before. And what we did was that we organized people that we know or in our church who were interested in doing mission trips. But and then we would take them to Ghana. They didn't have to be medical. Anybody who had a passion for helping anybody and was interested in going, we encouraged them, we signed them up, and they went with us. But the good thing was that we also, like a lot of people, if you want something to be successful, you have to have people on the ground who have a passion also. And that is what we had. And so we will take teams to Ghana and we'll do free medical clinics. We will buy medicines, and the people would normally volunteer their time. That is those on the ground. And those going with us too, they paid their own way to go. So we went to, and on a typical 10 to 14-day trip, we would hit 3 different areas. And in terms of the medical clinics, but then those were usually at the weekends. But during the week, the other thing we did was to go into schools, both a secondary level and middle school level, to go and teach the kids about sexual abstinence and the fact that in order to achieve their dreams and aspirations, they have to concentrate on, on their studies. And one of the dream killers is early pregnancy. So we harped on that and so on. And in the midst of doing that work with students, we found out that after some of our programs, especially in girls' schools, the girls would come to us and said, Auntie, I've been sexually abused by this person or that person, and they felt guilty, they felt ashamed. And so that was something we started incorporating in our work, that it is not your fault. You've been sexually abused, and tried to inspire them to dream in spite of that. And that led me to writing the first 2 books that you mentioned for those who were victims of sexual abuse. And the second one was for parents and guardians to teach their children before, they get into that situation. Because I always say that in a lot of the developed countries and other places probably, parents and guardians are the ones who teach their children how to be safe around strangers and even around family members, because you can be abused by family members. And so the teaching comes from theirs. And when I used to see quite a bit of younger kids, I used to say that when I'm going to examine them and their mothers are in the room even, and I would tell them, well, we'll have to look down there and see if everything is okay. The kid would look at their mother first, as if, is it okay for her to do it? And that is what we need to inspire, and teach our kids so that they know what can be done by who and who should touch them and so on. So I harp on all of those things in some of the books. And then the last book that I wrote, I felt that if I could write a book addressing issues of safety, that was the third one, issues of safety with young people, then not just safety concerning sexual abuse, but around the house, in the neighborhood, at school, and so on. And that led to the third book. And then, like I told you, we started with these free medical clinics. We have pharmacists, we have nurses who have worked, and other doctors who have worked with us over the years. But in the last 4 years or so, I felt that I would want to shift from the acute medical clinics that we did and concentrated more on screening for cancers. Okay, so for the last 3 years or so, we've teamed up with some other partners in Ghana, where we do community screening of women for cervical cancer and breast cancer. So we've been doing that for the past 3 years, and doing more education in terms of chronic diseases like high blood pressure, diabetes, just letting people know that these are chronic conditions, and so they have to continue taking their medicines and so on and so forth. And that kind of led me to write my last book, The Woman's Guide to Her Body and Her Total Health. So everything kind of
One
progressed in
thing
that
led
way.
to the other.
Yes.
Wow. That is a lot of, work that you're doing there. And can you just maybe tell us something a bit about the impact with all these programs that you've been going all these years? Give us an idea of some of the impacts or the feedback that you've received from this.
Yeah, I think one of the reasons also that I kind of started moving from the acute clinics,
Yeah.
To they are good, and people benefit. But I find out that a lot of people, when they hear there's a free clinic and there's free medicines,
Yeah.
they kind of flock, there, and somebody may come and they don't even have any medical thing, but they want the medicines and so on.
The free
And
things. Okay.
yes, free things, yes. And so, of course, we also started, we just don't go and do the clinic, but before the clinic starts, we'll have a little talk on high blood pressure and diabetes, and the fact that they should follow up with their primary care physicians, with the healthcare clinic in the village or whatever. And we sometimes even had some of the healthcare workers who worked in that particular area come and join us too. And we can make referrals. We've found a lot of people, either sugar is very high, we find a lot of people blood pressure is out of the roof, 180 over 110 and so on. And with those cases, we would write a letter and give it to them to go and follow up, although we give them medicine for a little while. And it is in some of these things that we find out that people would say, yes, I was told that I had high blood pressure, but I was given medicine and then I took it. And then, I thought that was it. And so we would educate them and let them follow up at the local clinic that is present. In terms of the cervical cancer screening, we have used, um, you cannot do everything. So what we do is that we partner with others, especially nurses and midwives, and that's the exciting thing that I think people should know about, who are being trained to screen women for cervical cancer in the community. And that's a lovely thing, because a lot of this is usually done in a clinic or in a hospital. But these ladies are taking it to the villages and to the towns after they've been screened. So some of them come and help us when we are doing our screening. And those who are caught, that there's something abnormal, we give them a note to and refer them to the district hospital or so. And we've had a few people testing like that who have been referred, and they've gone on to get treatment. So that is also an impact. And I think the other impact, which is more on this side, is that sometimes we've taken people from the US who've never been to Africa, and they see, when they go and they see, when we go to the schools, they see that the children are so intense on learning more and etc. I know one time we took a lady, when she came back, she came and finished her bachelor degree and went on to do a master's, because she was amazed at how Ghanaians are so eager to get education while they have it here. In fact, I must say that that's just one example. But for most people that we've taken on mission trips, their lives have been changed themselves because of what they saw, and how they realize that they are so blessed, but they are not really appreciating what they have on this side. So those are some of the impacts that I think have been made on both sides.
Thank you so much. I just wanted to touch on the screening. I think it's a very, very important and vital service that you are providing. As you know, I think some people wouldn't just get up on their own volition to say, I am going to get a screening.
That
You
is
know,
exactly.
it's
Mhm.
not something that people do normally. But with services like this, people will come, and then, thankfully, if there's anything nasty going on, then it will be caught early. So,
Yes.
whoa, good, good, good. So, all these work that you're doing, I know you haven't even talked about the education bit, the school kids that you talked
Yeah,
about
yeah,
a
I
lady
know.
coming, because there's so
You're like,
many. But I
yeah.
think especially with the upcoming program that you are going to, or the health fair. Would you want to
Mhm.
tell us a bit about it?